Come in. I just closed that door for privacy. My name's Miranda. I'm going to be doing a head to toe on you today. Is that all right? Mm-hmm. Okay. So first, I'm coming in. I'm looking at you, looking at your physical appearance, your level of consciousness, your skin color, nutritional status, your posture and position, your physical, if you have any deformities or anything like that, your facial expression, mood, affect, your speech when you respond to me, your hearing because you're listening to my voice, as well as your personal hygiene. We would first start off the head to toe with weight, height, and stuff like that, but I don't have any scales or anything like that. We would also test the patient's vision with the Snellen chart, and I would have her stand 20 feet away from the Snellen chart and read across the chart to see which line she could read to, and that would determine how well she can see. Next, I would get a urine specimen from her and also give her some privacy, leave the room for her to gown up. In this instance, we have already gowned her in her choice of clothes that she wants to do for this head to toe. I'm going to position her at first with sitting up and the legs dangling down. I'm going to first assess her skin by starting with her nails and her hands. And her skin is warm, dry, intact. And we would also assess the skin throughout the exam when we are assessing for the other parts of the body. I'll start with the scalp and hair and cranium, feeling for any deformities or any lumps or anything like that. And I don't feel anything. We would also take vital signs. I would take her radial pulse. I would also assess her respirations, her blood pressure, and her temperature if needed. Okay, then we're going to look at the face. I'm going to assess her expression. I'm going to assess for symmetry, and the symmetry is the cranial nerve 7. We're symmetrical. I'm going to then palpate the temporal artery and also palpate the temporomandibular joint. I'm going to ask her to open her mouth and close her mouth. Okay, then we're going to palpate the maxillary sinuses. This is right underneath the eye. Now I'm going to palpate the frontal sinuses, which is right on the eyebrows above her eyes. We're going to move on to the eye, and we're going to assess her visual field, which is cranial nerve 2. I'm going to have you put your hand over one eye, and you're going to tell me when you can see my fingers, okay? Mm-hmm. Now. Okay, now the other. Now. Okay. Next, we would check the corneal light reflex with a pin light, and this should be equal in both eyes. And it is. I am next going to observe the 6 cardinal gaze signs, and I'm going to use my pin light, and we are going to look at the light, but not move your head, okay? Just move your eyes. Okay. So next we're going to assess her pupils. We're going to assess for perla, the pupillary light reflexes, as well as we just observed the corneal light reflex. I'm going to look at her pupils, and we're going to see if they're reactive to light. They are. We can see that they're equal, and they're both round as well. We're going to test for accommodation. Okay, now look at the full body. All right. Next, we are going to inspect the external structures of the eye, looking at her eyebrows, her eyelashes, and her eyelids. They all look symmetrical and normal. Then we're going to look at the conjunctiva of her eye, which is pink and moist. And we're going to look at the sclera of her eye, which is white. Okay, then we are also going to look at the cornea and then the iris. Then we will, we're going to move on to the ears. We're going to, I would use an otoscope for this, but I don't have one, unfortunately. I will explain what I'm going to do though. With the otoscope, I would observe the tympanic membrane and then I would inspect the external ear, looking at position, alignment, symmetry, the skin as well. I would also move the auricle and push on the tragus to assess for tenderness. Next, I would do the whisper voice test. We're going to cover one ear, and I'm going to whisper in the other, and you're going to repeat what I say, okay? Cat, dog, test. Okay. Now the other. Shirt, pillow, phone. Okay. All right. Next, we're going to do the Weber test, which is I would use a vibrating tune fork, which I do not have at the moment, and I would place it on the midline of the skull and ask the patient where she heard it at. Next, I would do the Rennie test, and I would place that vibrating fork on the mastoid process and assess for bone conduction. Then I would place it near the ear and assess for air conduction. Next, we're going to move on to the nose and the sinuses. I'm going to check for patency bilaterally. We're going to place your finger on one side, and you're going to breathe in and out. Now the other, breathe in and out. We're also going to assess for symmetry and lesions in the nose. And then I would inspect the NURS. I would use a nasal speculum on an otoscope, and I would observe the nasal cavity, the turbinates, as well as the nasal septum. Next, we are moving on to the oral cavity. I'm going to use my pen light, and I would also have a tongue blade used, but I do not have one at this time, and I would inspect her teeth, her gums, the oral mucosa, as well as the tongue. I would check for symmetry of the palate, and it's symmetrical, and I would also check the uvula for symmetry. With that tongue blade, I would also check for the gag reflex. And then I would ask her to open her mouth and say ah, and that's assessing cranial nerves 9 and 10. I'm going to ask her to stick out her tongue, and that's assessing cranial nerve 12. Next, we are going to move on to the cardiovascular system. I'm going to ask you to lie down. We are going to palpate the peripheral pulses. I'm going to palpate the radial pulse, and I'm going to do it on both sides to check for symmetry. I'm going to also assess the popliteal pulse, as well as the posterior tibial pulses and the dorsalis pedis pulses. They are all a 2+. I'm going to assess her lower extremities for edema, and there is none present. I am going to check for capillary refill by squeezing on her fingertips, and there are less than 3 seconds. I am then going to palpate the chest for thrills, vibrations, and I'm going to locate the apical pulse. So I'm going to palpate for the vibrations or thrills first. And there are none present. Now I'm going to locate the apical pulse. Okay. Now with my stethoscope, I'm going to auscultate the carotid arteries. I'm going to auscultate the aortic area. I'm going to auscultate the pulmonic area, the tricuspid area, the mitral area, now I'm going to observe her respiratory rate and rhythm. Now if you'll sit up for me. Now I am going to observe the thorax for configuration. And I am going to palpate chest expansion. That's symmetrical. Now I'm going to auscultate the breath sounds. Now in the front. Now we are going to talk about the breast. I'm going to teach this patient how to perform self-breast exams. If you'll sit. Okay. Now, first of all, when you're doing self-breast exams, you're going to stand in front of the mirror so you can see. We're going to first put your hands above your head, and you're going to assess for symmetry of your breast. You're going to note any dimples or any asymmetry or anything like that. Next, you're going to sit down, and you're going to put your hands on the tops of your thighs, and you're going to push. And when you push, you're going to also note for the same thing, asymmetry, if anything dimples or retracts. Now you're going to clasp your hands and squeeze against each other, and you're going to do the same thing, okay? Next, we're going to lie back. And you're going to palpate around your breast area. and you're going to feel any lumps. You're going to also palpate this axillary area. And you're also going to palpate the tailless fins. Okay? You're going to palpate your nipple as well. Okay? And you can go ahead and sit back up. And you're going to do this every month around the same exact time. And for women of childbearing age like yourself, we're going to probably do it. The best time is during your menstrual cycle at the end between the 4th and 7th day. But it has to be around the same time, okay? Next, we're going to ask you to lay back down. And I am going to look at your abdomen. I'm going to get a drape for her privacy. As we pull up her gown, I'm going to inspect the abdomen for contour, any scars, which she has a few, and we're going to assess for striae. Next, I'm going to auscultate bowel sounds in all 4 quadrants. And they're present in all 4 quadrants. I'm going to then percuss all 4 quadrants. Okay. Next, we are going to demonstrate light palpation. I'm just going to press on your tummy just a little bit, okay? Mm-hmm. And now we're going to do deep palpation, and I'm going to press a little bit harder, okay? You let me know if there's any tenderness or anything like that. Next, we're going to assess for rebound tenderness. I'm going to press in and let go. Does that feel tender? Okay. We're going to sit up. And I am going to assess for CVA tenderness by placing my hand on your back and hitting lightly, okay? Mm-hmm. That feel tender? Okay. We are now going to demonstrate some range of motion. So lay back down. We're going to move your leg out, and that's abduction. Now we're going to move it back in, and that's adduction. So now I'm going to ask you to flex your feet, which is pronation, and then point your toes, and that's supination. Okay. We are also going to screen for scoliosis. So if you'll stand up for me. I am going to stand behind the patient as she touches her toes. And you're going to assess the spine for any curves, and you're going to assess the hips for any asymmetry, which she does not have. Okay. Now you can go ahead and stand back up. Now I'm going to stabilize her spine, and I'm going to ask her to please bend backwards. Now we're going to bend forward, and we're going to rotate to the side and the other side. And now bend to the side and bend to the other side. Okay. You can sit back down. We are also going to check for some muscle strength. I'm going to ask you to squeeze my hands. Okay. Now push against my hands and pull. I'm going to do the same thing with your feet, okay? I'm going to ask you to push against my hands. Now pull against them. Okay. Now we are going to assess the reflexes. I don't have a reflex hammer. I would usually use one. But if I did, I would tap here for the brachial reflex. I would pull her arm up and tap here for the tricuspid reflex. Then I would come around here and tap here for the radiobronchial reflex. Then I'm going to go to the quadricep or patellar and tap here. Go to the Achilles and tap here. And then I would assess her plantar and check for a Babinski reflex, which would be the flaring out of the toes. Okay. Next, we are going to do the sharp versus dull test on her arms, hands, legs, and feet. So this is sharp and this is dull, okay? Mm-hmm. So close your eyes and tell me what this is. Dull, sharp, 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 dull, 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 sharp, dull, dull, sharp, dull, sharp, sharp. Okay. Next, we would assess the light touch with a cotton swab. I don't have a cotton swab right now, so I would just place it against her face and see if she felt the touch. Okay. Next, we are going to assess for sterognosis, and that is where someone recognizes an object just by touch. And I'm going to ask you to close your eyes, and can you tell me what that is? I can. Next, we are going to determine cerebellar function. I'm going to ask you to stand up for me. Now, we're going to walk across the room and back. Okay. Now, I'm going to ask you to walk heel to toe across the room on your tippy toes coming back, on your heels back across. Okay, now come back. You can go ahead and sit back down. Okay. Now we're going to do the rapid active motion. So you're going to do this, 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 faster, faster. Good. Okay. Next, we are going to do finger to nose tests. You're going to touch your nose. Now touch my finger. Touch your nose. Now touch my finger. Touch your nose. Touch my finger. Touch your nose. Okay. All right. So now we're going to check the cranial nerves. We didn't do Robert. So I'm going to ask you to stand up and close your eyes. And this is the Romberg test. If you lose balance, then that's a positive sign, but you're not, so it's negative. So go ahead and sit back down. Now we're going to check the cranial nerves. For a factory, I'm just going to get something that is very familiar, like an orange peel or some chocolate or something, and put it under her nose and see if she can identify it. We already tested cranial nerve 2, 3, 4, 5, and 6. For 7, I would give her something to chew, and she would chew it, which is intact. We already did the facial and the acoustic, as well as the glossopharyngeal and the vagus. We also did the spinal accessory, which is 11, as well as 12, which is the hypoglossal. And that, do you have any questions for me? Okay, Well, that concludes your head to toe assessment. I'm going to step out for a bit and I'll let you gown up, and if you can think of any more questions, you let me know, okay?
Okay, thank you.